Hey guys, welcome to my channel. So I'm gonna give you the an overview review of autonomous nervous system, or basically I am specifying over the cholinergic system. So guys, the first thing you have to understand for being known with this whole chapter, autonomous nervous system, is the anatomy. So you have to think like this. So this is something around cranial area. So you can call it a cranial. This is the sacral area. So you can call it the sacral area. This is the thorax area, and so you can call it a thoraco. This is the lumbar area, so you can call it the lumbar. So guys, basically the thing which is here is that the craniosacral area is specified for parasympathetic system, and the thoracolumbar is specified for the sympathetic system. Okay, sympathetic nervous system, and this is where the parasympathetic nervous system. So I guess it's clear now that which area is specifying for which system. So I'll gonna clear it out. So we are more likely to be concentrating over the pharmacological section of the autonomous nervous system, or basically the cholinergic system. So firstly we're gonna see the whole scenario of the ANS. Okay, so this is the presynaptic neuron, and this is a postsynaptic neuron. Wait, Mm, this is a postsynaptic neuron, guys, and as you know, the let me clear one more thing before this. So we are studying the cholinergic nervous system, and there are two systems for the ANS. One is the cholinergic nervous system, and one is the adrenergic nervous system. Further out, adrenergic nervous system is called as sympathetic nervous system. Okay, and cholinergic nervous system is called as parasympathetic nervous system. This one is also called as noradrenergic nervous system. Basically, specifically, this is the noradrenergic nervous system, and yeah, that's it. Sympathetic nervous system, adrenergic nervous system, noradrenergic nervous system. So this is the thing to be cleared out for first. Okay, the neurotransmitter is the thing which is transmitting the uh, neuronal susceptibility. Basically, you can say it out from one neuron to the other ones, and the parasympathetic nervous system carries the neurotransmitter called as ACH, acetylcholine. That's why we are uh, calling it as the cholinergic nervous system. I guess it's more clear now, guys. Cholinergic nervous system, guys. So this is the thing. This is the parasympathetic nervous system. This is the sympathetic nervous system, guys, and this one carries the uh, noradrenaline, guys. So this is basically called as the noradrenergic nervous system. I guess I don't need to write furthermore, or adrenergic nervous system, or this noradrenaline also called as norepinephrine, guys. Okay, so don't mix it with adrenaline or epinephrine. It's a different thing, and it's a different thing. I'll gonna show you the difference between the adrenaline and noradrenaline very soon too. Okay, so don't mix it with that thing. So yeah, the basic thing we're gonna do is that to know that what the autonomous nervous system is working out, guys. Okay, so I have told you that there is a vesicle, there's a postsynaptic vesicle also. The acetylcholine is being synthesized within this vesicle itself, neuron itself, and it is going, oh fuck, and it is going toward this postsynaptic vesicle. Okay, so here we have one receptor, here we have two of the receptors, and is working over here. And if we're gonna talk about the cholinergic nervous system or anticholinergic nervous system, you can stop the transmission of acetylcholine from this area itself. You can stop its reuptake from this area itself, and you can directly work upon these two receptors itself. Am I right or wrong? Correct me, you guys. Okay, so further out, when we're gonna talk about the drugs itself, we should firstly talk about the mode of transmission from which it is getting transmitted, and the synthesis of the acetylcholine. Okay, basically the mechanism of propagation of the action potential. So this is the vesicle, guys. Okay, this is the vesicle, this is the vesicle. Okay, and wait, let me draw a proper diagram. So this is a presynaptic cleft. This is the area for the vesicle. Okay, and here the neurotransmitter for the cholinergic nervous system is stored, and here is the channel for the entry of the calcium. Okay, so calcium is going to enter from here, and it is going to give the stimulus to this one, and this neurotransmitter is going to, vesicle is going to contract within it, and the neurotransmitter is going to be squeezed out, and the neurotransmitter, which is the acetylcholine, is going to come in between these two clefts, and it is going to create a synaptic reaction or something like that. And this thing, this neurotransmitter is going to reach within this receptor. Okay, so basically this is the whole system, guys. Let me clear this out. So we've talked about this thing. Okay, now we're gonna talk about this drugs. So drugs, guys, we're gonna talk about the drugs. Okay, so firstly we're gonna talk about the drugs which are acting upon the synthesis or the reuptake of the acetylcholine. So the first drug is the hemicolinum. Okay, what it does, it blocks the reuptake. Okay, if it's blocking the reuptake of the acetylcholine, then for sure the acetylcholine is going to be accumulated within this cleft, and it will gonna increase the concentration of ACH within the synapse. Cool. The second drug is the vesamicol. It's quite clear from its name itself that it contains the vesicle, so it will gonna decrease the exit of ACH from vesicle. Okay, vesicle itself, it's not in use. Basically they are from the experimental use, for the experimental use more. They are not within the clinical uses, guys. The third one is the botulinum toxin, guys. Okay, botulinum toxin, botex or botulinum toxin. Basically what it does, it blocks the calcium action and release of ACH. So this is gonna decrease the concentration of ACH within the postsynaptic neuron. So I guess it's quite clear from now. Okay, so let's go within the next page, guys, or rather clear it out on from here itself. Now we're gonna see the drugs. Basically we're gonna see the cholinergic receptors, guys. If we'll talk about the receptors, there are two types of receptors: nicotinic receptor and muscarinic receptor, guys. Okay, if we're gonna talk about the nicotinic receptor, The nicotinic receptor is further divided within the NN and the NM type, guys. From the name, it's clear itself that it's situated within the ganglion and both on SNS and PNS, guys. Okay, and this is situated within the neuromuscular junction, guys. So for sure this is going to affect the muscles and this is going to affect the CNS. Okay, the brain and the spinal cord. Okay, it is more likely to be associated with the contraction of muscles, if I'm not wrong. Now we're gonna talk about the muscarinic receptor, guys. Second receptor, muscarinic receptor. This one has so many of its types, but I'll gonna make you remember which sort of is, guys. Okay, M1, M2, M3 and M4, M5 is more likely to be useless. Okay, the M1 is more associated with the stomach, so it works within the increasing and decreasing the acidic nature of stomach. This is more likely to be associated with the dil, and it's gonna work upon the dil ka dhadkan, which is the heart rate, maybe increasing, maybe decreasing. M3, everywhere except stomach and heart, most likely to be bronchus. Okay, most likely to be glands, pupil. The concept of closed angle glaucoma came from here itself, guys. GIT, bladder and more so. Okay, M4 and M5 are most likely to be associated with the CNS, not CNS specifically, most likely to be with the, sorry guys, the brain. So not very much to be remembered, just stuck with these three ones. This is gonna help you to clear the examinations and all. Okay, so let's go over the next one, guys. All heart rate. Okay, no. So if we're gonna talk about the reuptake, or basically the rate limiting steps, the rate limiting steps of acetylcholine. So these are the reuptake, and second one is the entry from vesicle. Okay, so I've talked about three drugs, guys. Which one is the hemicolinum, second one is the vesemicol, and the third one, what was the third one, guys? Third one is the botulinum toxin. Okay, so remember these things. Now we're gonna talk about the drugs, basically drugs. So there are two types of drugs, guys: parasympathomimetic, parasympatholytic. Okay, this is gonna increase the concentration of acetylcholine, this is gonna decrease the concentration of the acetylcholine. So, and the main function of the acetylcholine is to increase the contraction, secretion, and to decrease the heart rate. This is the core. Now work upon this. If it is gonna increase the acetylcholine, increase in secretion, increase in contraction, decrease in heart rate. Okay, decrease in secretion, decrease in contraction, increase in heart rate. Okay, so the whole concept is lying within this one. Okay, मेरे शहर विच खाली गड़ अपनी एक जीप खड़ी मेरी थाने ते विच बदले ते दो लेना. So first one is the direct acting, and the second one is the indirect acting, guys. The sympathomimetic. We are talking about the sympathomimetic drugs. Okay, so direct ones are acetylcholine itself, not used clinically. Okay, reason being very short acting. Okay, because it gets metabolized within plasma itself by cholinesterase. Okay, there are so many types of cholinesterase, basically 3 to 4. ठीक है, BUCHE, ACHE and PCHE. And the most dominant within the plasma is the BUCHE, guys. Okay, so basically we're gonna talk about the direct acting drugs. Direct acting drugs on acetylcholine to increase acetylcholine. Okay, first one is the acetylcholine, not used, no use. Okay, second one the bithanicol. Okay, bithanicol. So this is basically used in the bladder atony, and the bladder came within the M3 receptor. Okay, so why it is used in the bladder? Why? If the patient is having a relaxed bladder, okay, if the patient is having relaxed bladder, then the urine may be retented here, guys. Sorry, let me make you imagine the whole situation, guys. So the urine may be retented here, guys, and if we're gonna increase, oh fuck man, and if we're gonna increase the contraction here, then this may get like this, and the whole urine, guys, is going to come like this. मैं पानी पानी हो गई, चलेगी क्या, ग्लास भरा है पानी भरेगी क्या, खैर, no issues. Okay, so first one is the bithanicol, guys. What the fuck has been happened just yet, man? Wait, oh wow, yeah. The second one is the bithacholine methanicol. Okay, so this one works over the heart basically, guys, and it causes tachycardia. Wait, it is used in tachycardia. Okay, it is used in tachycardia, so it must have been working over the M2 receptor, guys. Okay, pilocarpine. Used in closed angle glaucoma. Why? Because we need to contract. Okay, meiosis. We need to do meiosis, and it's working over the M3 receptor again, guys. Okay. The next drug is Civamelin. And it's a drug of choice for those patients who are having less secretion in what is this? What was the salivary glands? And this disease is called as xerostonia. Okay, guys. So now we're gonna talk about these were the drugs which are acting directly. So let me recall you guys, we have talked about the drugs. Some drugs like acetylcholine itself, bithanicol or bithacholine, whatever it is. You just need to remember its clinical significance. Bithanicol. Okay. In the next one is the pilocarpine, closed angle glaucoma. Next one is the Civamelin, guys. Let me recall you. Xerostonia. This is somewhere related with the Sjögren's syndrome also. Xerostonia, closed angle glaucoma, tachycardia, bladder atony. No, bladder retention. This one, no use guys. No use. बेकार है ये. Okay guys. ये क्या है? Okay guys. So let me erase this guys. Now we're gonna talk about the indirectly acting drugs guys. So indirectly acting drugs guys. Guys. Okay guys. So what does this mean? So basically this means that we're gonna talk about the drugs which are not increasing the acetylcholine directly by working over the receptor or its synthesis. They are gonna increase the acetylcholine by blocking that thing which is destroying the acetylcholine, which is the acetylcholine esterase. Wow, isn't it? Okay. So we're gonna talk about these types of drugs. So these are basically divided in two types: reversible and irreversible guys. Okay. So the reversible one are two of them. One is lipid soluble. Second one is water soluble guys. The lipid soluble is the physostigmine guys. Okay. This one can cross blood brain barrier. You know why? Because it's a lipid soluble. If it's a lipid soluble, it must be a third degree amine, tertiary amine. Okay. And it has the central CNS effect. Okay, this can be used. This is the drug of choice in atropine poisoning. Okay, this one water soluble is the neostigmine guys. This do not cross. This is the quaternary amine. So this do not cross the blood brain barrier. So this is more safe to be used because it's a peripheral acting. Okay guys. And one more thing, this physostigmine is natural and this is synthetic guys. Wow. Let me talk more about these guys. It's about to end guys. So let me talk about the physostigmine. Oh fuck. Physostigmine. Okay, so this one goes to 50% within the brain and 50% to the periphery. एहसास समझो यार, periphery लिखा है, ठीक है? Okay. Basically 50% to the organs who are having muscarinic receptor. Okay, this one do not have basically the function over the nicotinic receptor dominantly. So we're gonna talk about the Alzheimer's. So you must have heard about the Alzheimer's. So this is a brain. Oh fuck man. Man, what we have done, man. Okay, let me go back. Where is our physostigmine, man? Where is our physostigmine, man? Okay, no issues. We're gonna start from the one itself. So we're gonna talk about the physostigmine. मेरे को क्या, मेरा तो पढ़ रखा है, तुम्हें दिक्कत है। So this one goes 50% to the brain because it does cross blood-brain barrier, because it's a quaternary tertiary amine, and it's a lipid soluble. Okay, if I'm not wrong, 50% to the other organs, and because it's a cholinergic system, so it will gonna to affect the organs which are containing the muscarinic receptor, M type receptors. Okay guys, so let me talk about the physostigmine. If you have heard about the Alzheimer's disease, then this is the brain, and it contains the acetylcholine within the brains, and in and this is present within the basal neuron of Maynard. Okay, which one? The basal neuron of Maynard. Okay, so what happens in this is the decremency of acetylcholine, age related. This leads to dementia. Okay, and because it is age related, this is called as senile dementia, guys. Okay, so this causes the loss of memory in old age, and this is called as Alzheimer's disease. Okay, so this is the basic concept of the Alzheimer's disease, and this is the thing which is called as the senile dementia. So इसी को हम लोग बोलते हैं बुढ़ापे में सठिया जाना. Okay, समझे? So this is the concept. So this physostigmine is being used. This physostigmine is used in Alzheimer's disease. Okay, why? Because it increases the level of ACH, and because it crosses the blood-brain barrier, so it does increase the level of ACH in brain. So it will gonna help the patients of Alzheimer with sort of significance. Okay, if I'm not wrong. Okay, so because it is going to the brain, it's causing the improvement within this Alzheimer disease. But because it's also going to the solid organs which are situated within the periphery or within the non-cephalic region, so it will gonna act upon the receptors like M1, M2, M3, basically these ones, maybe M4, M5. So this one will cause the increase in acid. This one will cause severe bradycardia. This one will cause mydriasis. Sorry, meiosis. This contraction of bladder, and so. Okay, so many sort of side effects. बेसिकली कुल मिला के इसके काफ़ी सारे 100% साइड इफ़ेक्ट्स आने वाले हैं अगर हम बुढ़े को अल्जाइमर डिजीज़ में ये दे रहे हैं. सो वी थॉट व्हाई नॉट वील गोना मेक अ ड्रग विच विल गोना क्रॉस द blood brain barrier with 100% of accuracy. So this drug was called as tacrine. Okay, it was sort of drug of choice for Alzheimer. Am I right or wrong? Because it does crosses something around, not if not 100%, then 99.9%, man. Then why not it's a drug of choice? Because it's a hepatotoxic, guys. It's a hepatotoxic drug, and it's very 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 short acting, guys. यार अब बुड्ढे को हम ये तो नहीं बोल सकते हैं ना, जाओ दवा खाते रहो, वो हमें क्या दे देगा, गाली, और ऑलरेडी वो सट ही आ चुका है गाइस. So what we can do, we can erase the name of the tagline from our copy. तेरा नाम लिखा हो तुझे याद किया. So we made a drug which is called as donepezil. Okay, we made a drug which is called as rivastigmine. Okay, we've called a drug which is called as galantamine. So these drugs are very good drug guys. These are very long acting. बुढ़े की परेशानी खत्म. 99.9% से ब्लड ब्रेन बैरियर को क्रॉस करेंगे ये ड्रग्स. वाओ. एसिटाइलकोलिन एस्टरेज को ब्लॉक करेंगे ये ड्रग. ओह वाओ. नो हेपेटोटॉक्सिक. हमारा लीवर चंगा रहेगा. मैं भी चंगा, मेरा ब्रो भी चंगा, मेरी माँ भी चंगी. No. Okay, so these are the new drugs guys. What is the Alzheimer's disease? So this is occurring due to the accumulation of misfolded proteins. लिख देता, बोल देता हूँ यार, सुन लो. मिसफोल्डेड प्रोटीन्स के एक्यूमुलेशन से अल्जाइमर डिजीज का प्रोडक्शन हो रहा है. अल्जाइमर डिजीज बन रहा है ए बेटा अमाइलॉइड्स के एक्यूमुलेशन के कारण. ओके गाइस, सो I guess this much is a lot for today, and basically there are some more drugs which are called as ACHE blockers. ACHE blockers are done galantamine, donepezil, and what was the last one? Rivastigmine. Okay, and the NMDA blockers are also there. Memantine and educanumab. Okay, so monoclonal antibodies it is. And disease modifying drug है guys. ये basically underlying cause को target करता है. ठीक है, so this much is enough for today. So do like, share and subscribe my channel if you've liked